Let's be real for a second. Have you ever thought of anatomy as just another class to get through? All that memorization? But what if it's not about that at all? What if it's actually about learning to read the most important map a nurse will ever use, the human body itself? Well, today, we're going to dive into exactly that, why this science is the absolute unshakable cornerstone of nursing. And this right here, this visual really nails the core idea. Think about it. On one side, you've got all that foundational knowledge, the body's structure, how organs work, all the connections. And on the other, you have the actual hands-on nursing skills. Anatomy is the bridge that connects them, making sure every single action a nurse takes is accurate, safe, and truly effective.
So here's the game plan for this explainer. We're going to start with why anatomy is the cornerstone. Then we'll break down its core concepts. From there, we'll see how that knowledge gets turned into real clinical skills, how it helps nurses decode diseases, and finally, how it all comes together for the most important goal of all, patient safety. All right, let's jump into our first section, the cornerstone of nursing. And look, this isn't just some catchy phrase. Anatomy is quite literally the language that all other medical knowledge is built on. If you don't speak this language, the rest of it just doesn't connect. So what exactly are we talking about when we say anatomy? Well, at its heart, it's the science of structure. It's understanding the physical nuts and bolts of the human body, the normal way our organs are supposed to work, and the incredibly precise way all our systems are connected and coordinated. It's the what and the where of you. Okay, let's move on. When we say a nurse has to know their anatomy, what does that actually look like in practice? Let's get into the details of this blueprint of the body. We're talking about knowing the very specific shape of an organ, its exact location, and even its different layers. It also means understanding the crucial relationships between organs, how one thing affects another, and the overall layout of entire systems within the body. This is the detailed map that nurses carry around in their heads every day. And you can look at this map through a few different lenses. You've got gross anatomy, which is all the stuff you can see with the naked eye. Then there's histology, where you zoom way into the cellular level, which is so important for understanding disease. But for our purposes, the big one is clinical anatomy, which is all about applying this knowledge directly to patient care. All right, now this is where things get really exciting. Section 3 is all about how that blueprint, that map in the mind, gets turned into actual life-saving action. This is where knowledge becomes skill. Just look at this. On the left, you've got the map, the body's complex structure. And on the right, you see the result of knowing that map. Precise, skilled procedures, like giving an injection in exactly the right muscle, or starting an IV in exactly the right vein. One informs the other. And believe me, the stakes here could not be higher. Without that precise anatomical map, even procedures that seem simple can go terribly wrong. A misplaced needle can cause serious bleeding, a nasty infection, or even permanent nerve damage. So knowing anatomy isn't just about being good at your job, it's about actively preventing harm. Now, of course, technology helps. We have amazing tools like vein visualizers and ultrasound that give nurses a better view. And yeah, it improves success rates. But here's the thing, they're aids, not replacements. You still need that deep 3D mental map of the body to know what you're even looking at on the screen. Okay, let's take this a step further. We're moving beyond just doing procedures now to using that anatomical map to actually find clues about what's going wrong inside a patient's body. The principle here is so simple, but it's incredibly profound. You absolutely cannot recognize what's abnormal if you don't know inside and out what's normal. A nurse's deep understanding of a healthy body provides the baseline, the starting point to measure everything else against. Let's look at a perfect example. On the left, you see healthy alveoli in the lungs. They're designed perfectly for swapping oxygen and carbon dioxide. On the right, you see inflamed ones from something like pneumonia. A nurse who understands the normal structure sees that inflammation and immediately thinks, okay, gas exchange is going to be a problem. This patient is probably going to need oxygen. It connects the dots. And that right there, that's the leap. This is what we're talking about. A solid grasp of anatomy completely transforms a nurse's role. They're no longer just someone performing a list of tasks. They become critical clinical observers, constantly assessing, interpreting, and connecting what they see on the outside to what's happening on the inside. So this all brings us to our final and, honestly, our most important section, the anatomy of patient safety. This is the ultimate why.
Everything we've talked about so far funnels directly into this one critical outcome.
Think of anatomical knowledge as an active safety shield. It makes sure medications are given safely, it helps prevent errors during procedures, and it guides a nurse's hands to protect vital organs. It's the foundation of every head-to-toe assessment and the engine behind every moment of critical thinking. It is woven into everything.
Let's make this crystal clear with a really powerful real-world scenario: avoiding an injury to the sciatic nerve. This is a classic example of anatomy in action, and it's a big deal. Okay, so to give a safe injection into the gluteal muscle, a nurse uses their knowledge of landmarks on the outside of the body, like the top of the hip bone and a specific part of the thigh bone. Why? To find the exact spot in the muscle. But even more importantly, they know precisely where that massive sciatic nerve is located, so they can stay far, far away from it. This is anatomy preventing a potentially life-altering injury. And this quote just says it all, doesn't it? Non-maleficence is a fancy way of saying do no harm, and anatomical knowledge is the tool that lets nurses live up to that promise, allowing them to make decisions that aren't just smart, but are fundamentally safe for their patients. So if there's one thing to take away from all of this, it's this: the deeper a nurse's understanding of anatomy, the more accurate, the more safe, and the more effective they will be. It is a direct, undeniable, and frankly life-saving connection. Which leaves us with a final thought to chew on. You see, anatomy isn't a class you just pass and forget. It's a living, breathing map that nurses have to consult constantly. So the real question isn't if it's used, but how are the thousands of details on this map being used, right this second, to navigate the incredible complexities of patient care every single day.